Mercy, if you are ready, please take it away.
Good afternoon, colleagues and participants online. I will be taking you through event-based surveillance and Africa CDC's experience. Slide, please. So, as shown on the slide, we are going to look at a brief introduction of event-based surveillance and how it fits into Africa CDC's strategic objectives and the EOC watch mode. Thereafter, we'll look at key terminologies used in event-based surveillance. We will also look at event-based surveillance process and the various stakeholders involved in the EBS. And thereafter, we'll conclude with the Africa CDC's experience and lessons learned. Next slide. As part of Africa CDC's pursuit to realizing a safe, healthy, and secure Africa, one of our missions is to ensure the early detection, prompt and effective response to public health threats and outbreaks in the continent. Next slide. As shown above on the diagram, you can see that Africa CDC has 5 pillars, one of which is the surveillance and disease intelligence pillar. And that is where the event-based surveillance unit sits. Next, please. As we all may be aware, the Public Health Emergency and Operations Center has 3 modes: the watch mode, the alert mode, and response mode. And certainly all the EOCs in Africa should be in the response mode for COVID-19. However, they should be in the watch mode for other pathogens, especially the unknown pathogens. In the watch mode, we have mainly pre-incident activities, and the EOC operates in minimal staff to conduct routine and daily activities. Now let's take a look at EBS, which is part of the watch mode. As you can see, it's circled in red. It is worth noting that in the watch mode, ideally the Public Health Emergency Operations Center should have a dedicated team. I know so many EOCs call it the watch staff, and this team should be able to monitor a wide variety of media sources for reports of outbreaks or other events and signals within the continent or within your country. Next slide, please. So what is EBS and why is it relevant to early warning and response? So now let's take a look at EBS and how it's relevant to EWA, that is the early warning and response. So just showing you a scenario on how we can actually deduce the importance of event-based surveillance. Next slide, please. So to better understand the relevance of EBS, I'm going to run you through 5 case scenarios. As you can see here, we have a cluster of 5 cases who may or may not know each other. Next slide, please. As scenario 1 is a case that gets sick, doesn't get medical help, and dies at home. Next slide. Scenario 2 goes to a clinician, say clinician A, and consults and gets treated. Next slide. Scenario 3 goes to a pharmacist and asks for medicines just for the symptoms he or she is presenting with. Next slide. And case 4 goes to a traditional healer, as it is the norm in Africa. Maybe he or she was told that he or she's been bewitched by one of the family members. Next slide. Case 5 goes to a clinician B in a private facility and gets medical help. And we've presented 5 cases or 5 scenarios. And in most of our health system, could you just think out those of those, amongst which of these cases will be captured by your normal, your routine national surveillance system. Amongst the 5 cases, please next slide. Amongst the 5 cases, only case 2 went to a clinician that is part of the official reporting system. Case 1, 3, and 4 did not come to the attention of the health sector. And these are on official and informal sources. In some countries, the private clinic may not add to the country's routine reporting system as well. However, we have now the IDSR, the 3rd edition, which is being advocated for countries to adopt. And the last meeting we were part of, many countries are actually advocating for the inclusion of private health facilities in the reporting systems within their countries. But now, based on this presentation, this case scenarios, we now see the relevance of event-based surveillance. Next slide. So according to WHO, more than 60% of the initial outbreaks reported comes from unofficial informal sources. Additionally, EBS, contrary to IBS that requires large laboratories to actually confirm cases, EBS actually is advantageous in that it requires minimal technical resources. However, both add into the national surveillance system of every country. So they don't replace, but they rather complement each other. This is because EBS, the EBS process can be streamlined to improve screening for information by using tailored algorithms and not necessarily having to go through the rigorous process of confirming in the laboratory or actually conducting gene sequencing to actually know a particular pathogen. But action could be taken earlier on before the pathogen or the causative agent is being diagnosed in the laboratory. So what is EBS? Next slide. EBS is the organized collection, monitoring, assessment, and interpretation of mainly unstructured ad hoc information regarding health events or risk which may represent a threat to human health. Kindly take note of the terms unstructured ad hoc, because this is where EBS differs from IBS. Next slide. So community-based surveillance is also one of the terminologies commonly used in EBS, which is the systematic detection and reporting of events and signals by community members. Next slide. Health facility EBS simply means EBS conducted in health facilities. And all healthcare workers are involved in this process. Next slide, please. So another terminology that is commonly used is signal event, and that will be used in subsequent slides. A signal is an observation that may represent an event occurring in a population, a pattern, for example, a cluster of cases with similar illnesses, or a cluster of animal deaths. Those are all signals. And an event is an occurrence that can threaten public health, or simply put, a verified and confirmed signal. So when a signal is verified and confirmed to be valid, it becomes an event. Next slide, please. So now let's take a look at these various stakeholders that are involved in EBS. In most countries, we have a very structured system of information flow, and these follow the administrative structure of the country. So usually we have the higher administrative level, which is usually at the national level. And then we have the intermediate level, some call it the regional level, some the province. And then we have the local level, usually the district, which the districts in most countries, where it's more of the operational, forms the operational sector of the country. And then we have the community, where we have some the community health workers, and then we have also the community volunteers. So this is how most of the systems in countries are being structured. And for event-based surveillance, we are not instituting, or we are not advocating for the institution of a new structure. We actually advocate that information follows through the same channels that have been set up in the country and adopted. So it follows the same procedure. The community health volunteers actually detect the signals at the community level, and they report maybe to the community supervisors, usually attached to health facilities. And these in turn report to the local level, that's the district. Usually we have a community, an event-based surveillance or a surveillance focal point at the district level, who actually does aggregations of data. But in this case, when the community volunteer reports to the supervisor, the supervisor then reports to the district focal points, and then it moves to the intermediate level and then to the national level. And then feedback on verification and whatever action is being taken follows the same channel downwards. Next slide. So let's look at the major steps that are involved in event-based surveillance. So we have 5 main steps of EBS. We have the signal detection, signal reporting, the triage, the verification, risk assessment. We'll be looking at each of these steps as we progress along. Next slide. So this is a summary of the main functions of EBS. It actually shows from when a signal is being detected and translated into an event to when action is taken. So like we said before, when a signal is detected, it is being triaged and verified. We're going to see what triage and verification entails. And then once it's verified, it becomes an event. And that event, that's where risk assessment is conducted. And after the risk is classified, then the response team takes action. Next slide. So detection. Before we get into detection, or before we start, or any surveillance team who want to engage in EBS start to detect, it is very, very important to define the list of signals and establish possible sources for EBS. So to be able to detect efficiently with minimum white noise, we must clearly define our list of signals and disseminate these signals at all levels. Once this is done, it is important to establish a list of sources, and this list of sources should be tailored to the local context, because the sources in country A might not apply to country B. So let's begin by looking at the different sources where we can detect signals and events from. Next slide. Okay, so as you can see, these are all possible sources of EBS. We have communities, we have the health facility, we have churches, we have schools, laboratories, we have the media, animal sector, etc. So these are all possible sources where you can actually detect signals from. Next slide. So looking at what happens within the community. So the community members and the volunteers are in charge of detecting within the communities. And in the health facilities, detection is done by healthcare workers or laboratory technicians. And also, hotlines could also be a source for detection, where people call in and report signals or events within their community. And the media could also be a very important source for detection, where we have the print media, we could also have radio, we could have web-based sources. And this should, media scanning is preferably encouraged to be hosted at the national level, since we have the technical capacity there. So, next slide, please. So reporting, once the signals have been detected, so depending on the agreed channels within the country, the signal should be reported immediately. And it could be reported through the same hotlines or maybe the emails or fax, depending on what the country's capacity is. Next slide. Triage, after it's been reported, we have to do sorting, because definitely the person who is reporting might not have the capacity to actually grade the signal according to its relevance, whether it's relevant or not to EWA. So maybe the supervisor at the level of the community, the supervisor has to do some sort of a triage. And this triage means sorting out if the signal is relevant to early warning and response, and should be referred to the list of established signals. Remember, we said at the beginning that before you start the detection, you should have a list of established signals to always refer to and see whether or not your signals meet the next level of reporting. Next slide, please. So once triage is done, we have to do verification. And verification is actually just to determine the validity of the signals, whether or not the signal is true. And if it corresponds to at least one of the signals predefined by the country or by the system. Next slide. So imagine that you have maybe 5, as part of your signals, you have a cluster of deaths, a cluster of deaths. And then maybe you have a report coming in from a community health worker that we have 5 people who just died by the road and they're all bleeding, And you go there and discover that these people were being hit by a truck. That's a cluster of death, but definitely it does not meet the criteria of reporting, given that you're looking at more from the disease perspective. So that is where verification comes in, and the validation and the risk assessment also plays on that as well. So if it's a false rumor, discard. And you confirm as an event if the information is true and meets one of the predefined signals. And then once that happens, you report to the next level. Next slide. So risk assessment is done only for events. Once your signal is being confirmed as an event or is being translated to an event, now the risk assessment comes in. And regardless of the source of information, risk assessment should be carried out at the intermediate level, because those are the people who actually have more details regarding the event. If the intermediate level doesn't have the capacity, then the national level should also go down to support. And definitely we always advise that during this process, the lower levels also are consulted, because they are the people with the more of the information. See, next slide, please. So the process on possible outcomes of risk assessment, I will not belabor this since most of us are experts and we've been doing this, but no investigation should be required if the event does not constitute a risk to public health. Like I said, for instance, if it's a cluster of deaths and these deaths are not from maybe a known pathogen or is not caused by any of the events that we are looking at. So maybe it's just an accident, and then you have people bleeding, from their nostrils. So in that case, you just discard, and then you continue to monitor if it's a potential for a health, or it has a health risk, or has a potential of causing a health challenge or health risk to the population. And also monitor if no cases in humans exist according to recently gathered information, but there's a potential for more cases to be reported in the future. And if also the mobility or mobility of the disease or of the known causative agent is expected. For instance, most countries now are having measles as being endemic within most of the regions. So say, for instance, just a case of a child presenting with the symptoms, or a case that meets one of the signals that you're looking at and you're looking at measles. So it's within that range. It's just one case, and it's not an unexpected event. So therefore, you just continue to monitor until maybe it hits the threshold, and then you start calling it now an outbreak. And then you respond if the mortality or morbidity is higher than expected, if the disease is unexpected, there's possible consequences to trade and travel, and the severity is higher than expected for the particular disease. So it's very important to know what to do depending on the outcome of the risk assessment. So this is a quick, next slide. So this is a quick metrics that most countries are using. It's been developed by WHO. And we know that the risk assessment is based on the likelihood of occurrence of an event and the public health impact or the consequence of that particular event. So it just shows you that, this is a very easy way of most rapid risk assessment. Remember that this is event-based surveillance, and you don't want to overwork the analyst in conducting a very rigorous risk assessment. So most often you want to just use this based on the minimum information that you have to conduct. Next slide. So Africa CDC's experience, I'm going to run us through this quickly on what as an organ, a specialized organ, we've been doing regarding EBS. So next slide. So to start with, Africa CDC has a number of guiding documents and tools that have been guiding the process, or has been supporting the analysts to perform event-based surveillance. So we have Africa CDC event-based surveillance framework, and this framework is available on the website, so you can easily access as a country if you want to adopt. We also have an event-based surveillance SOP that we're currently working on. It's still work in progress, but we are at the final phase of finalizing. But we've been using the SOP to guide our internal systems and processes. Then we also have an event-based surveillance event management system that we are currently using to track events and also to conduct regular calls with our regional RCCs. And then we also have an Africa CDC activity tracker that we are also using routinely. So next slide. So these are stakeholders that are involved in our process in the conduction of event-based surveillance routinely. So we have analysts at the headquarters. We have 4 general analysts, and we have 6 COVID analysts that are specific just for the COVID-19 event. Then we also have 4 functional RCCs. That's the Eastern, the West, Southern, and Central. The Northern RCC is still work in progress, and hopefully we'll have it established. Then we have the focal points in all member states, in all the 54 member states. And then we also have the disease surveillance leads or heads of EOCs in countries. Next slide, please. So this is how our process works. We detect, we filter, we triage, we report, we verify, and then we conduct a risk assessment, and then we disseminate our reports. And once the reports are being disseminated for events that are very high or high risk or very high risk, we flag them and report immediately to our response division. Next slide. So the HQ analyst detects, we use EIOS, we use TweetDeck, the TweetDesk, that's Twitter, that you can create multiple pages to kind of monitor the trend of a particular hashtag just to detect. Then we have the Gideon, we have Medicis, we have Global Incident Map, and others. So we use a wide range of sources to detect. So the HQ analyst also gets verified information from official sources like the Ministry of Health, WHO, and other regional blogs. And once we detect, we send the signals to the ROCC. So the ROCC receives the signals and verifies with member state focal points through emails, regional WhatsApp groups, and also regional echo calls that they have bi-monthly. And the focal points now receive the signals and verifies now with the country national surveillance leads in the human and animal sector. And feedback is sent following the same channel to Africa CDC. So that's how basically our processes work. So the EIOS is actually our main, I will not call it source though, but it is somewhat an aggregator that pulls different media sources together. So that's the main web search that we use. So we do rapid scanning and flag events that have interest to us, that meet our reporting criteria. So next slide, please. So I'll just explain what from where we get information. From official sources like Ministry of Health and WHO, FAO, and all those. So on official sources, we have the web-based aggregator, which is the EIOS, and other sources like GFIN and other web-based sources. And we also use television channels like Al Jazeera and BBC to detect. Next slide, please. So as seen above, we detect signals and events from a very wide variety of web-based sources, some of which make use of the automatic process like Medicis, health maps, and some of which are being moderated by humans, like the ProMed. For ProMed, I think it's something that countries might want to enroll. You just need to sign up and then you get regular feedbacks. It helps you to not only know what's happening within your country, but also within your neighboring environment. And we also have expert networks like EpiSouth, Médecins Sans Frontières, Save the Children, and a lot. So currently what we do is that we are making use of all this variety of sources, but we pay more attention on EIOS because it's an aggregator and it compiles information from many sources. So the EIOS facilitates the collection and organization of public health information by combining the inputs from various reporting systems into one system. So it has a real-time processor and a filter that actually helps to use artificial intelligence to actually, bring events that are relevant to whatever you've stated as your criteria for reporting. Next slide. So the analyst. So we're looking at what we do routinely, like daily, what our work is as AP analyst or event-based surveillance unit. So the analysts at the HQ and the ROCC, we scan through the EIOS and flag new events. And we discuss these flagged events bi-weekly. And also we send out daily EIOS digest of flagged events that are actually relevant to our EWA. We send them out, especially to our the other teams or the other divisions that are implicated, like the EOC, the Disease Prevention and Response Unit, or division, sorry. We also have the Disease Control and Prevention division that is just newly created. So we send this daily digest to all of these divisions. And we also host meetings with EBS analysts to run through event tracker. So we have an event tracker that once we detect these events, we insert these signals into the tracker, and then we do regular calls to monitor the events or the signals. So we send out our final reports every Friday by 1 p.m. However, these reports are still being done, still being disseminated internally. So the ROCC focal point and ECHO coordinators also discuss events with member states within their region. So they have the bi-monthly ECHO calls that I just make mention of, that they have this discussion. They also verify rumors and signals during this call. So this is, next slide, sorry. So this is kind of an enrollment custom capture form that we use. This is from our event management system that has been developed. So all the analysts have access to the system. Once we detect a signal, we enter it into the system and then track to the end. So next slide. So once you enroll once we enroll the system, the system asks you to do a risk assessment for events. So the EBS unit only prioritizes public health impact. Like, we don't do the very rigorous risk assessment that you expect the EOC to do. So we just do very moderate or simple risk assessment, just to classify or prioritize public health impact into high, moderate, or low, and also the geoscope. So we leave more rigorous or thorough risk assessment to the disease preparedness and response colleagues, who are better positioned to interpret the available information and provide guidance based on the level of risk. Next slide, please. So I will not go into this. This is just how we classify our risk. We classify our risk into low risk, moderate risk, high risk, and very high risk after the risk assessment is conducted. Next slide, please. So after the risk assessment is conducted, we definitely will come back to do an update, because definitely it's dynamic. Diseases, the information is changing and all that. So we have an update section where we come to update the event based on the new information that we get from the ground. We update. Next slide. This is just an overview of how our system looks like, or our report looks like. We have a map that makes use of GIS and actually positions our events on as you can see above. So we have different events in different countries being displayed on the map. And then we have on the right, we have the narrative or the description of that event. So this is kind of how our report looks like at the end of the week. Next slide, please. Okay, so currently Africa CDC is monitoring over 107 events across the continent within all the 54 member states. Sorry, 55 member states. And we have half of these events are COVID-19 events. So as you can see, this is like a summary page of all the events that are currently active in the continent. And that's a lot. Next slide. So we should be wondering now, how do we integrate EBS into the existing surveillance system? Because of time, I might not be able to go into the depth of this. Next slide. I might not be able to go into the depth of this, but it should be noted that EBS and IBS are part of the epidemic intelligence, and both support EWA. So they don't replace each other, they rather complement. And remember that you could also detect from the IBS if you're monitoring trends. You can always see where there's an upsurge, and you can detect that there's now an outbreak. But definitely EBS comes strictly to improve on early warning. So its main function is to improve early detection for prompt response. Next slide, please. So how do you set up an EBS system in your country? How do you go about that? It's simple if you have a dedicated team, not a new team, by the way, a dedicated team that's already within the EBS or within the surveillance division or within the EOC. The first thing is to identify priority list of signals that you want to work with. Remember that signals are broad. They are not tied to specific diseases, but they give you a clue that you could be dealing with disease A or B, but they are very broad. So you define your priority list of signals that you want to work with. The second thing to do is to define stakeholders with clear roles and responsibilities. Who is doing what? And we recommend that these stakeholders should be multi-sectorial. So you're working with people, with colleagues from the environment sector, animal health, human health, and there should be that synergy and coordination. Identify key EBS sources applicable to countries' context. That I'd already explained. So maybe radio could work in a particular context. In another context, maybe it could be the television, just depending on the country's context. Define reporting and verification channels. It is very important to know how you want to report and what structure it should follow. So if you are looking at the structure on the ground, which is the ideal, you should know, okay, are we using phone calls? Are we using paper-based? Are we using electronic applications? But it should be very clear on the channel that is being used to report. But when you are choosing this, just put in mind that EBS has to be very prompt. If there are delays, then it doesn't add value to the already existing system on the ground. Establish capacity for analysis and interpretation. Surveillance is data translated to action. So it does not make sense to just have the information, but there should be a way of interpreting the information for prompt action. And then at the end, develop an M&E mechanism to regularly evaluate and improve the system, so that it is not your system is not static, but as the things are evolving, new technologies are evolving, the system should also be upgraded to meet those standards. Next. So I'm ending here. This is my last slide. So we're looking at the lesson learned as Africa Center for Disease Control. Africa's CDC has been doing a lot of work on EBS. However, we've encountered a lot of challenges. We've realized that we cannot progress if EBS is not using the multi-sectorial approach. Because sometimes when we send information to countries for verification, the human sector really doesn't have that collaboration with the animal sector. So we have that gap, and sometimes signals fall in between the cracks. So there's that need for a multi-sectorial approach within countries. And as Africa CDC, that's what we are also struggling to build. It's work in progress, by the way. For a continent-wide EBS mechanism to succeed, there is need for dedicated focal points within member states. And I know this is also happening within countries. verifying and sending signals for verification. And then, people are busy with other stuff. They take time to send back feedback, to give feedback, has also delayed a lot when it comes to signal verification and reporting. And as Africa CDC, we've encountered that challenge as well with our focal points on the ground. So we look forward to advocating for countries maybe to designate new focal points, or we see how to strengthen the system that we already have. More advocacy needs to be done to engage countries on verification and reporting of public health events. Sometimes we know events are a little bit political, to confirm, so this is, sometimes you're like within the rock and the hard place, to get verified information. It's really tough. There is need to harmonize EBS terminologies across countries and with other institutions. I remember the last meeting that we had with other partners. There was this controversy or this discrepancy between ROMOs, signals, and all that. People were like, okay, what's the difference? What's the difference between an event? What's the difference between an alert? And different countries will call it differently. There is need to emphasize that event-based surveillance does not replace the existing surveillance systems, but complements. I'm happy that the IDSRO has actually highlighted EBS as a key component towards enhancing early warning and response. And the third edition actually has a component of EBS that is being preached across the continent. And Africa CDC also has the framework, which we have stated clearly that event-based surveillance has to be integrated into the already existing surveillance system on the ground. So EBS is not coming to be a standalone division in any country, but it just comes to fit into the system that already exists and improves on early warning and response. With this said, I am happy to be here, and I'm very, very pleased to have been given this opportunity to present. I'm looking forward to your questions. Thank you.
Thank you, Mercy, so much. We will now move into the question and answer portion. As you have been doing, please submit any comments into the question and answer section, and we will pick them up. I'd like to take a moment just to summarize a few points so people can remember the presentation and frame their questions. We talked about the importance of EBS as an early detection system and that it must be a multi-sectoral approach. We spoke of EBS specifically being for that unorganized ad hoc information, which defines it, right? Which distinguishes it from other systems. We discussed information flow and the importance of using administrative structures that are context specific in each country. You then, Mercy, kindly took us through the 5 steps of EBS, signal to translation and into action, and emphasized defining signals. We then spoke about if capacity is if there's not enough capacity, that you might need to incorporate other administrative levels of help, but that it's really critical to keep ground level people involved. And finally, we dove into Africa CDC's experience, emphasizing again EBS as this complement to improve early warning systems. And I imagine, and there have been a lot of wonderful questions thus far about that system. So I'm going to start answering questions. Mercy, they'll be for you as well as our other panelists joining us. I'll take a moment just to say how excited we are that Jan from WHO is joining us, and Shim Wewe, who's a public health professional with a background in laboratory sciences and focusing on emergency preparedness and response. So without further pause, I'll ask the first question, which is, Mercy, how much time would you say that each step in the EBS takes, recognizing that risk assessment may need to happen quickly?
Yeah, thank you so much. That's a very interesting question. Normally, from the time of detection to the time of verification, we or from the time of the detection to the time of reporting, it should be 24 hours maximum. So we expect that once you detect, you report immediately. However, we know that there are some hiccups given that Africa, we have issues with technology, but definitely that's why we've spanned over to 24 hours, that you should report within 24 hours. And from time of reporting to verification, it's another 24 hours. So we expect that if the worst happens, 48 hours after reporting, that event should have been verified. And then once the verification takes place and it's true, like the event has been, or the signal is validated, that this is true and meets the criteria for reporting, that is part of your signal reporting list. Remember that you have to come up with a list of signals to begin with. So once that happens, risk assessment should be done within 24 hours. Because remember, we are dealing with public health threats. And we are also dealing with different teams. The person who detects will not be the same person to verify, because he or she has very limited knowledge. Maybe it's a community volunteer and is working with a list of signals, like, okay, a cluster of deaths, animal deaths. Now he sees maybe a cluster of deaths by the seashore. Maybe it's just because of flooding, but then he or she is reporting because that means it's part of the signal list. But whoever is coming to do the verification should be an expert who comes and says, oh, this is because of flood. It's a flooding, and then maybe discards that signal. But if the signal is going to the next level, then the risk assessment team should be different, because different expertise in different steps. So you don't expect that to be within 1 hour or 2 hours. It's not practically possible. Yeah, over.
Thank you. So the next question is a little bit about coordinating the EBS system and signal with other teams that are working. So how does EBS work, let's say, with the rapid response team or other teams that might need to spring into action?
Okay, thank you so much. I think this is also very, very nice. Response is not part of EBS. Because of limited staffing, most EBS colleagues, or surveillance teams sometimes get into response and, just, it's a teamwork, but definitely those are different actions. So the response team takes over after risk assessment. So even though the EBS team does the first risk assessment, it's usually advisable for the response team to come do another in-depth risk assessment. So these are two different teams. EBS ends at the level of risk assessment, and then response takes over. But then if there are specific capacities to be built, maybe to enhance surveillance, community surveillance detection as part of the response strategy, then the EBS team can come support. But ideally, the response team takes over after risk assessment and the flagging of the events, like this has been confirmed and it is true, this is what is happening. They hand over the events now to the response team. Over. Thank
you. And so another question about coordinating and specific to ACDC's system. How is ACDC working with existing surveillance structures, let's say like the WHO's structure?
Thank you so much. Remember that data is one of the most sensitive issues we have on the table. Data sharing is very, very sensitive. And we've been working with countries so far to get data. Like I said, I demonstrated how we work with countries through our regional offices. So we don't really have like a platform where countries, we can pull data directly as of now, but we're working towards that. So for now, what happens is countries actually share data with us, and then we mine the data to come up with an aggregated data for the continent. So for now, it's still being done using a lot of manual work though, but hopefully in the next months, we already in this conversation of trying to pull data directly from the DHIS tool, because our EMS has been built on the DHIS tool and has that capacity. to pull data directly from DHIS to from member states. But we also appreciate some countries that are also sharing their raw data with us. And maybe this is just an opportunity for me. Let me see the opportunity to call for more openness and transparency in sharing data with us, because it will go a long way to also improve on the continent wide data reporting or reporting on events. Yeah. Over.
I'll pause if Chimwewe or Jan wanting to weigh in. So another question, the questions are very active, so very interesting subject. So how does EBS and signal collection continue while there's an emergency open event? And by how, meaning what are those challenges as they arise, and who's in charge essentially during that time period?
Okay, I remember when I began by saying that even though the EOC is at maybe the response mode for COVID-19, it could be in the watch mode for other diseases. For a particular event that is already, the outbreak is already ongoing, maybe you could come up with, we call it simplified disease case definitions. I remember for COVID, what happens is that even though the response was ongoing, we came up with, I was part of the team who developed the signals for Kenya. We developed a signal that could help communities actually detect cases of COVID early enough. However, event-based surveillance works a little bit differently, not just to, I will not call it to enhance surveillance, but it helps to detect at the very beginning. So once you really know that particular disease is ongoing, that event is ongoing, EBS might not really help that much, because the other existing, the IBS, the indicator base will pick the cases and report to the national level. But EBS actually is very relevant before the onset of the disease. I don't know if that makes sense, but it's most relevant before the onset, and helps you now to say, okay, to establish that the disease is in the system or in the country, or it's happening in the community for prompt action. And once that has been established, then the IBS can take over too, because definitely the same information will fit into the IBS and will be reported back to the national level.
And there still might need to be surveillance for other events, right, that aren't necessarily connected to the ongoing emergency.
Perfect. So it has to be in the watch mode for those other events.
Right. So a question, you spoke about the sources. How is social media playing into all that's happening? Is it a complicating source of information? Like you spoke of certain types of media, but how is social media being used?
Yeah, like I said before, as part of our source, we use the tweet desk, that's Twitter, and we use hashtags, specific hashtags, depending on what we're looking at. I remember that even though social media gives us a lot of unofficial information, or it's an informal source, remember that we also have official Ministry of Health accounts on those social media platforms that give us very reliable information. So I'm happy that EIOS, which I spoke of, which is like an aggregator, is now pulling information from Twitter. And that is really helpful, because before we actually were missing out on a lot of valuable information from social media. So presently we are mining a lot from social media. Twitter, we are using even WhatsApp groups to get information. We are also using Facebook accounts through official and unofficial sources, because we have WHO's Facebook account, we have Ministry of Health, the different Ministry of Health's Facebook account, and they also have Twitter accounts or Twitter handles that we monitor closely. And that could be useful for countries because we have key informants in the community. We have bloggers that blog a lot on some of these events. And if we could identify some of these handles or accounts and track and monitor them, that would really be helpful because a lot is happening on the social media space, believe me.
Very active from, I think, everyone's perspective. So I think we're on to maybe one or two final questions. You spoke a bit about Africa CDC creating an SOP currently ongoing for EBS. I think was one of your summary slides, and how you set one up. Is this something that also should be used at a country level, context specific for that country and locality, and there should be an SOP in place?
This SOP actually guides our internal processes, but we have a framework, the Africa CDC EBS framework. And that framework actually outlines how a country can set up an EBS, what stakeholders they should be looking at, what, how they should function, how the system should flow, and all that. So we have this framework and countries have been adopting. I know Tanzania is adopting already. Kenya is using the framework. A lot of countries are using the framework already, and it is very, very useful in that it actually gives you a lot of information on how an EBS should work. So they could always refer to that framework because the SOP has been customized or has been tailored strictly to suit the Africa CDC's context. However, we remain open to provide technical support to countries in developing some of these working documents. So currently we are doing an assessment in the Eastern and Central African region. And we just want to assess the level of implementation of EBS, where countries are the gaps, the challenges, and what resources they need to establishing a functional EBS in their country. So once that assessment is done, we'll also be able to see some of the gaps that are within the countries. I know we'll be assessing both the technical and the operational systems. And part of it is also the SOP. Do you have a functional SOP and all that? So once that happens, we'll be able to know where to tailor more support. And we are also open to receiving support from countries should they need. For technical support, we will be very open and happy to provide.
I'm sure you will be taken up on that offer. So I'll move into one final question before we close out. And that is, I remember you saying that EBS system setting it up is relatively low tech required, right? But are there challenges in low-income countries specific to EBS and in those contexts? And if so, what are some possible solutions?
Please come again. I didn't hear you well, please.
Sure. Are there certain challenges that low-income countries might face when adopting an EBS system that would be unique to those settings? And if so, what are some solutions?
I think Africa, in fact, most of the challenges in Africa cuts across. Like we have issues with the internet. Internet bandwidth is a problem. We also have issues with mobile connectivity. From one region to another. There are some areas that are completely blacked out. But like I said, EBS is a very dynamic thing. Like you can always contextualize it to the realities that you have as a country. I'll give an example. In a community where you don't have internet or you don't have the mobile network, definitely you don't want to use the mobile calls as a channel of reporting. Maybe you might want to use maybe a local bike rider to transmit information from place to place. So you just have to contextualize it. And in that particular setting, you could, if the radio is the most widely used, you could also detect from the local radios. So it just depends on where you are and what the local context is. You know, you just have to tell all the sources and the methodology to suit the particular context. But for every other country at the national level, that's why we recommend that media scanning should be done at the national level, because we expect that at the national level, the watch staff or whoever has been dedicated to perform that role should at least have a laptop or a desktop to do the media scanning, you know, and get information from. But definitely, if you don't have people in the lower levels feeding the media with this information, you might want to change your strategy to see how to detect, you know, because definitely you want to have a more sensitive system to pick information. Over.
Thank you so much, Mercy. And thank you to all of our participants for your questions and comments.